Okay, so again, welcome to this session of the EASM training project. And today we will talk about the relevance of individual patient assessment in order to develop personalized sport-based intervention. But first of all, let me show you the program of today's session. And as you know already, we will do a brief recap of our previous session in order to be sure that everything is clear and well done. As you remember, last week we discussed about the relevance of verbal and non-verbal communication, and we all agree on the fact that it is very important to use a non-verbal communication styles which is coherent with the verbal one, because of course the non-verbal dimension is very important for our patients and also in world of sport-based activities. Then we discussed also on some aspect of body languages, like having an open gaze, smiling, having a good posture, and so on, because of course these elements are very important to create a sort of comfortable setting for our for the people to which we are interacting. And then also we discussed about the concept of individual and personal space. And as you remember, you brought me many examples on how the concept of individual space is also completely different according to the type of sport. For example, I remember that Alejandro told us that in rugby, it is also possible to stay side by side, also at the back of the other person. So it is not an unfair practice, but otherwise it's something that is very, very welcome because of the rules of playing rugby. But we made this discussion also with Matteo on the fact that instead in people, for example, with autism spectrum disorders, also they have a very strict concept of the space. So it was really, according to me, an important aspect to discuss with you, this of individual space. And finally, we concluded our last session on how to improve our non-verbal communication skills, and we discussed on the importance, for example, to keep in contact, to nod our head while we are conveying a message and we are saying to someone else that we agree with them, trying to smiling, and also to use a tone of our voice that is coherent with the content of the main message that we are trying to communicate with the other people. And then again, I would like to thank you again for sending me this information, because really I guess that we are coming closer in our contact. And if you wish, also I can send to you a description of my usual context of work, so that we will really know each other. Also looking forward to our first in-person meeting in Brussels. I guess that we will have really a great time there, because following so many virtual sessions, for sure it will be very, very different to be really there in the same room and discussing together about all these things. And so now we can move on to the main topic that we will discuss today. As I already shown you in the first slide of today's presentation, we will discuss on the fact that it is really important to evaluate the preference of person in practicing sport activity. Here you can see some possible questions or aspects that I thought it would be appropriate to evaluate in a person that should be engaged in a sport-based activity. Of course, please feel free to share with me your idea, your concern, because while I was preparing this material during last days, I was thinking of the fact that basically these slides have been prepared, these materials have been prepared by a team of people that primarily are not coaches or sport trainers. So while I was approaching this topic, for me it was really interesting to think about the fact that probably when I would like to involve a person in a sport-based intervention, I would first of all ask him or her, have you ever played any kind of sport during your childhood? Are you currently involved in any sport activities? And also, I guess it would be great to obtain a description of any kind of sport activities that they have practiced, and also evaluate the reason why they have loved it or hate it. But again, I would like to ask you, do you think that these questions are useful? Or, and another question is for you, do you usually evaluate all these dimensions in your practice or not? Who would like to start?
Non ho capito la domanda, se nello sport del nostro?
Sì, nella vostra, in your current practice, do you ask people some questions like the ones reported here? For example, if I come to your, I don't know, to your playground for the first time, and we meet for the first time, what would you ask me? Why you are here, or I don't know. How do you start the conversation with the person coming to your playground? Or office, I would say, but it is not really an office, I guess.
You can start with, hello, what's your name?
Okay. And then after that, I mean, would you ask or would you evaluate some of these aspects that I have reported here in these slides or not? Can you see?
Yeah, it's
if someone come to say my playground, so, and the first thing I would ask him or her, how long you have played this, or where have you been before, or something like that. So I think these are very good questions, and I think I have used them before.
Before start practicing, let's say. Okay,
yes.
So thank you very much indeed for sharing with us your experience, because really I guess that this way of approaching people would be very, very important and sensitive for people with severe mental disorders, because you know they will need to be really engaged in this relationship, and so these questions are also a way to try to connect with them and try to understand their reasons for being involved or not in sport activities. In particular, according to me, but again, I am a psychiatrist, not really a sport coach, I guess that it is important also these questions here, which is in green. How has this sport activity impacted your sport participation? So if my question is that if the things that you have done are really relevant for your future practice, because you know this aspect is important also because if people gain negative experiences, probably they would reduce their motivation in trying again and again in doing the same activity. I guess that, for example, in particular, Matteo, working with the children with disabilities, probably has this kind of experience, because I guess that when you have a child with this kind of difficulties and is not able to do a thing or practice any kind of sport, for sure, it is a sort of frustrating thing, and so that should reduce either a capacity and also decision to continue to take part to that activity. I don't know, Matteo, do you agree with my hypothesis?
Yes, but many of my children are the first experience, and
You cannot formulate really these questions.
yes, and I take note during the activity how can do the new children. I take note, for example, about coordination, verbal, non-verbal, speaking, because, for example, this aspect is quite important because in this way we decide to the type of group is better for this need. For example, with a non-verbal person, we are assigned a one person to take care about only this child.
Yeah. Thank you, Matteo, for this punctualization, because I guess it's really important. And of course, as you can see also here, these slides are due to the fact that I usually work with adult patients. So of course, I am not really in touch with people that are at their first time experience. But at the same time, I would say that of course it is important your point of view, and it is important all the things that you were saying, so that you take note of all the aspects of behaving of that person, that child, in the sport activities that you propose to them, in order to understand the main issues and the main aspects.
Probably this grid could be useful also with adults. If you want, I could share with the group the next time.
Yeah. Well, thank you very much indeed. I guess it would be a great idea to also have these suggestions based from your experience. So thank you, Matteo. I would like to show you this video that I found very, sort of impressive, because it started from is probably I would say an aspect that we know that sport is effective, but how do we really know that also it is so useful for people with severe mental disorder? Because we know that from a sort of general point of view, that sport is good for our well-being, but probably we are not completely aware of the fact that it is a useful tool also for the people with mental disorders. And I found this interesting.
I've had severe depression a lot of my adult life. I'd also developed sort of a drink problem, which happens a lot when you're homeless. Your life comes sort of a long round of going to the job centre, psychiatrist, GP, and it's sort of thinking out of the box a little bit. Projects like this are rare throughout the country. Exercise is really good for mental health. It releases all sorts of chemicals in the brain, and that being a bit fitter helps you to focus on having a healthier lifestyle. You can be very inspiring when you speak to you, so yeah, it helped a great deal. And it makes you feel really good about yourself. We're in the ring with a world champion. Just meeting people, that's a great thing. You don't really meet people, but you're sort of stuck indoors, staring at the walls. You can forget for a while that you've got mental health problems for a couple of hours. You're just in the gym with a group of other people. It's sort of a safe environment, non-judgmental environment. It helps people to know that people that are supporting them have mental health problems of their own. Inspiration, a bit of a too strong a word, but I can't think of one that's slightly less than that. But yeah, at least give them sort of hope that there's light at the end of the tunnel and they can sort of get on with things.
When I first came to Sporting Mind, I was really shy. Well, I'm a lot more confident now, which helps with my work. I'm happy to do anything. Oh, it makes me feel proud. It's good to do sport that makes you feel really good afterwards. The benefits for me is not only do you end up a lot more healthy, because I used to be quite overweight, By doing stuff regularly, you've got something to get up for, you've got to be there at a certain time. It gives you something to aim for each week to improve. When I first started, I was a member, and now I can run some of the sessions on my own. As a volunteer, I do football, badminton and yoga. I really like to help out with sport in mind because I want others to be able to achieve what I've achieved.
So I guess that this video should be also seen by other mental health professionals, in particular, I guess, from psychiatrists and child psychiatrists, social workers in Italy, and so on and so forth, because really, I guess that they shared a very important personal experience on the fact that sports is very useful to create also a a safe environment in which you can feel that you are able to achieve everything you want in your life. But the problem is that, as I already showed you in the previous session of this course, that probably the motivation in people with severe mental disorders is very low. Deciding to start practicing any kind of physical activity or sport-based activity. And so this is the reason why we are here today, and we have had so many sessions of this training course, because we would like to identify with you a useful strategy to try to engage with a higher successful rate of people with severe mental disorders in our sport-based intervention. And I guess that for sure it would be important to try to evaluate some specific characteristics that people have and can influence their attendance to this kind of intervention, because we know also that due to these differences, the motivation to adhere to the sport-based intervention and to sport programs that we can develop for them is really important, something that can change and can have a really relevant role. And also because we know that when we involve and engage people with mental disorders in this program, and also in the phase of developing this program for them, this is another aspect strictly associated with the highest probability to have a success in the long term. Because of course, when you are involved in this procedure, you are a sort of more motivated. The problem is that not always people are really motivated to do so, so that also sometimes they are not able to express their individual preferences. And so this is the reason why probably if you think about the list of questions that I showed you at the beginning of this session, I guess that they are very important, so that we can try to understand which are their preferences. But when we talk about all these dimensions, we are trying to evaluate their behavior towards sport-based activities. But we should consider that the behavior is a complex phenomenon which is due to the interaction in capability, motivation, and opportunity. And as we will discuss in one of the forthcoming about motivation, and we will discuss also on the importance to use a motivational interviewing approach. First of all, we should evaluate also the attitudes and the expectation of people towards this kind of intervention. And first of all, I would like to ask you, what do you think, what is an attitude in general?
The natural abilities to do some things.
Anyone else? As any other suggestion?
I think it's a state of mind when you are going to go like even a gray rock cross because you want to do something because you like it, or you have this kind of inner voice or something that you are going to do something.
Okay, so an attitude. So who is speaking?
No, io Alejandro venne, sì, dico in italiano perché che attitudine, che non so come, l'approccio, diciamo, il modo in come affronta, diciamo, l'attività, intende come è legato anche molto, diciamo, percepito come motivazione, il feeling che si crea con la persona, come approccia lo sport, l'attività.
Okay, so basically you agree also with the definition that Matteo provided us. So an attitude is a feeling or a belief about something. And of course, we know that having a positive attitude toward everything, in this case, toward sport, is for sure a thing that improve the adherence to this activity. But this is also true in medical setting, in psychotherapeutic settings. We know that people must have a positive attitude. It should be also motivated to start also this kind of program. And nowadays also we think that even starting a treatment with a pharmacological drug, your attitude toward that drug is important as well, because of course you should have a positive attitude orientation toward the thing that you are starting to do, to practice, or to assume. And then another question, what do you think, how do people form attitudes? Matteo, this is for you.
I'm a cognitivist, so I answer with experience.
I am cognitivist as well, so I basically agree with you. In fact, as you can see here, I wrote that probably our attitudes are based on our previous experiences done by our side or done by our relevant or beloved person, or also by the people that are surrounding us. So the problem is that having positive experience, of course, can lead to positive attitudes, while having negative ones is associated with negative attitudes as well. And again, I guess it is a very important aspect is to evaluate, because if you think about the questions that I have shown you, probably all that questions regarding to the fact, have you ever practiced sport, and how did you find it, of course, are relevant to us, because they give us the opportunity to understand why people have, for example, specific negative attitudes against sport, because of course it could be due to the fact that while they were young or adolescents, they had some bad experience in any sport competition. And then, what are some negative attitudes, I would say, compared to sport? For example, these ones are some possible examples, like exercise, waste of time, doesn't interest me, I am not good at sports, I won't improve, who cares about being active? Of course, why I am sharing with you these concerns, because when you work with people with mental disorders, these are aspects that are very, very frequent and are very often reported by them as a possible reasons for not being involved in any kind of sport activities, or more in general for in any activity. It is important to know that this can be some of the negative attitudes to evaluate. And again, what sort of experience can lead to negative attitudes about physical activity? For example, failures in sport competitions, feeling of being incompetent, embarrassment in physical education or in sport settings. And I guess, in fact, that Matteo, working with children, probably is very, very careful regarding all these aspects, that probably when you practice sport with your children, you are also looking at avoiding the creation of this kind of negative attitudes, because of course you know that a negative attitude developed during early phase of your life is something that will be probably with you throughout all your entire life. But you know, the problem is that in particular for us that are working with adults, of course, we are dealing with the consequences of these negative experiences, negative attitudes that are already well defined and on which we can do not so much things. So this is the reason why it is important to think about all these aspects. And what is about some physical activity that people dislike? Dislike, for example, the fact that it is necessary to be patient in order to get some improvement, to the fact that some physical exercise can be very dangerous or very difficult, and also the efforts that are needed during the practice of this physical exercise. And for all these reasons, I guess that we should, when you will be in the practical part of developing this piloting action, probably you should, or I would suggest you to evaluate these three dimensions: the capability of that person, the opportunity of that person, and his or her motivation. And please consider that the part related to motivation will be a specific focus on another forthcoming session that we'll have. While I guess that these two aspects, those of capability and those of opportunity, are really very important, because we should take every condition to explain the person that being active is something that is affordable for everybody, that we are here for explaining to him or her how to become active, and so on. And of course, another aspect very important is to explain or to evaluate how much the person feels to have the ability to be physically active. Again, I guess that probably Matteo, working with children, is not really used to formulate these questions as it stands, but probably from a sort of indirect point of view, you will obtain this information that are essential for you in order to create the best program for each child in your project, to be sure that they will achieve a specific goal during that project. As a part of this EASMH project, we have also performed a search of the literature, and I have identified this assessment tool that has been developed by some researcher working, I don't remember exactly where, but I guess in the Northern Europe, and they developed this questionnaire called the Choice Task Experience Preferences, because they developed this instrument that, according to me, is very, very easy, and also can be also very useful, because the questionnaire have this part of instructions, and then you will have a table summarizing the most frequent type of exercise, design, intensity, and eventually incentives that can be provided. And then you will give to the patient this very simple sheet in which you can ask him or her to fill in. And so my suggestion would be that if you agree, I will send to you over by email this assessment tool, because I would like to include this tool in the pilot project that you will going to develop. Of course, I know that every one of you has a specific skill in providing a specific sport activity. For example, Alejandro told me that he is working in rugby, otherwise Alexandro is working in basket team, and Matteo with football, if I remember correctly. So of course, the type of exercise is related to the field in which you have already this experience. But I would, in any case, ask you to use this instrument, because it will be something useful for us in the process of engaging with the patient. Because of course, for example, if the person says, okay, I would like to practice sport once a week, you for sure will know that if you propose to him to come to the playground 5 days per week, for sure it will be a failure, because it is something not expected and not decided by the patient. So I would say that this can represent a sort of initial track or initial point of starting this conversation about sport, and then starting from this, you can develop then the sport program according to the preference of each patient. What do you think? Do you think that this would be useful, or it's a waste of time?
I think if you have the first time and you get to clients this paper and use of about 5-10 minutes, they fill it up. So I think it will be useful and helpful for me as a coach. So
You would use it, I would say.
Yes, I would say, because I think there is a good information. I like this design, like individual without supervision. This is a good question example, I think.
Okay, thank you very much, Reto. I am very pleased that you find it useful, because you know, again, in this case, it is like you are really the expert. I am just trying to collect as much as possible information on this topic. I was also wondering that another possible idea should be that while I will send it to you by email, and then you can also think about the opportunity to translate it in your own language, native language, so that it will be easier also for the patients to fill in it. Or otherwise, I don't know if you probably think about the fact that you can formulate these questions to the patients, and then you will fill in by yourself. I don't know. This is another idea that just came up in my mind. I don't know what do you think? But again, I guess that it is important to try to define a common methodology before you start thinking about your pilot action. Because again, you should have already known the fact that this pilot action is really a core part of this project. So for us, it's very, very important that you will be able to do something very relevant for patients with severe mental disorder, and also useful for them. While we were in Costanza, we were also discussing about the fact to include any kind of assessment tools for evaluating the efficacy of these interventions. But I guess that at the end, we decided to skip this part because, of course, when you think about efficacy, for me as a doctor, efficacy would be, for example, the reduction of severity of some symptoms, while for you as sport coaches, efficacy should be I don't know, the time of resistance in practicing any kind of physical activity. So these are two very different concepts, both very, very relevant, but otherwise it would become very difficult to homogenize or to identify just one indicator really relevant for our patients and for our project. And I don't know, again, do you think that, so I don't know, Matteo, Alejandro, Alexandro, what do you think? Would it be useful, or at least a point, starting point? Probably, Matteo, for you would be difficult because you work just with children and they are not really able to say, okay, I would like to do once a week.
Maybe we could answer this question to relatives.
Okay. About their expectation, you mean about the type of sport activity that according to them would be better to practice for the baby?
Yes, or also support teacher.
Also.
They already know the children and they passed many much time with them.
Yeah, okay. This would be great according to me, because you know, I guess that this would be in the direction of trying to create some a sort of personalized approach to them and to yes, to create something that is tailored to their needs. So yes. Alexander, what do you think instead?
No, it's the same. I mean, you cannot ask them what they want. I mean, you can, you need to ask either the parents or some other that what expectation do they have, because if I'm going to ask them, they will say, okay, low intensity, 10 minutes, and that's it. It's
okay, but don't you think that also if they will give you this kind of hours, 10 minutes once a week, low intensity, it would be also nice that if you start from that type of activity, then after, I don't know, 2 weeks, 4 weeks, I don't know, 2 months, you will give them again the sheet, asking them, okay, but now fill it in now. And maybe also the fact that probably after 1 or 2 months, they will change their mind. And in that case, they will ask, okay, 2 times per week. Also, this would be a good idea, because you know, I completely agree with you that also I am not a sporty girl. So if you ask me how many times per week would you like to do sport, I would say also once a week or probably once a month. But again, it would be also important just asking me, because I can express my personal opinion. And now we are looking for it. Because the idea is that if you really try to fit the expectation of that person, probably it is something more useful in order to increase the adherence to the program. Otherwise, I guess that, okay, you think for me it would be appropriate to have 3 times per week, but if then I will not come 3 times per week.
okay, maybe so in my case, maybe they would like to come, I think, every day, but just to, so as intensity, they would like to come and play, I think, every day, because
Okay.
they after every practice they ask me, okay, when do we see next time, when do we see next time? So I think they would like to come every day, but about the intensity and the, I don't know, the type of
Yeah, the design, probably they will not be able, you say, you mean you thought to express really their experience,
Yes,
their
yes,
preference. And
yes.
so,
But I think if I have time to see them every day, they will come every day.
okay. But also I was wondering, probably this could be another, I would say, sort of a brief exercise for us. So once I will send this form to you by email, I would ask you for make any amendments and modification of this sheet. So please feel free to modify, to change it so that we should have something more closer to the reality of what people would say, because I guess that it is very, very important, because again, you know, this sheet has been prepared by myself, and I am a psychiatrist, I am not really engaged in sport activities. But you instead have this kind of experience. So if you are able to think about how to improve this sheet, I would be more than happy to use the version that you provide me, or maybe also just including the suggestions that you are saying now here. What do you think?
It's a good homework. Yeah.
Yeah.
Mm-hmm. Yeah.
Okay.
Maybe we could add some information about for example, the patient listen to us. How much the patient listen to us?
Okay. You mean listen and how much it's engaged in the conversation with us?
For example, if we make some advice,
okay,
and the patient try to
follow
use this advice.
Okay, yeah. So I guess that really your ideas are both very nice, and really I would be pleased to receive these inputs from you in order to improve this list of questions, because you know here you are expected to do a pilot action, but also this training from a certain point of view is a pilot training. So of course I am here also for collecting your feedbacks and your suggestions, because I guess again that you are expert as me, because I am expert in medical field, but you are expert in these other fields. So really I guess that that having this meeting together is very, very important, and also adding more information to the things that I have prepared would be a good way for improving our work and also spending better our time together in order to do something really useful for our daily practice. Okay. Okay. So now it was time for question and answers. I don't know if you have any other kind of specific questions.
No, I don't have.
Thank you. So considering that we have saved at least more or less half an hour, as I was saying at the beginning of this session, if you wish, I could also start introducing you the topic of the next session, or would you like to finish earlier? For me, it's the same.
I can finish earlier because I'm still at work.
Oh, who is speaking? Retu, I guess.
Yes. If it doesn't matter to.
Okay, so I would say that probably it would be easier to do like that, also because today we have also Sami that was not able to join us. So if we save time, then next time for him will be just one session missed, not two sessions. Again, just for make a very short recap, I will send to you by email again the slides of today. I will send you this short questionnaire that I have shown and present to you in a Word file, so that you can add any comments, any edit, any questions, anything you wish and you think it's better to include. And so before next session together, we can I will incorporate all these comments, and then we can have a very short discussion all together. And then I am still looking forward for the description, let's say, of these of that 4 questions by Sami, and by also Lewis and John from the UK, and while for the others I have already received this information. And again, please let me thank you very much, because I am really enjoying the activity altogether, and I am really looking forward to our meeting in Brussels. As Stefano said, you should already start booking your flights, because the days are fixed, and so we will have this all together on Monday, and then we will have this one-day training on the Tuesday, the 12th of July. And in next session, we will have also Francesca Cirulli that will discuss with us about the Spirit project. And that's it from my side. I don't know if Stefano would like to add anything else.
No, just those information you said regarding the hotel and the location for the in-presence meeting. So we will tell you soon, or through your
Contact person.
Your contact persons, your partners, the EASM partners. So by the beginning of the next week, you'll know both location and possible hotels to book.
Okay, okay. Thank you, Stefano. And now we'll also send you the slides, and have a nice day. We'll see you on the 23rd. See, yes.
The next session is on 23rd of June?
Yes.
Okay then, yeah, okay.
Yeah. I will send you a reminder in the due time, considering that it will be in 2 weeks. But
Okay.
because I have some other obligations at work, so not able to identify an afternoon for this training.
Okay.
Okay.
Okay,
Bye,
so
everybody.
yeah.
Thanks.
Thank you. Bye.
Thank you.
Thank you.
Bye. Bye.
Bye bye. Ciao Stefano.
Ciao.
Ma posso fare